Telomeres, Aging and Disease by Dr. Mark Rosenberg. Dr. Rosenberg is the Chief Science Officer for Rose Pharmaceuticals, which is a research and development company that produces oncologic drugs. Dr. Rosenberg started the oncology division of his company when his novel concept for treating cancer resulted in complete remission in a patient with metastatic stage 4 endometrial carcinoma. Rose Pharmaceutical has produced a new cancer cocktail analogous to the AIDS cocktail that will be delivered through a novel nanoparticle and preferentially gets taken up by cancer cells. Dr. Rosenberg is also president of the Institute for Healthy Aging. At this center, patients are treated with a combination of conventional and complementary techniques. In addition, Dr. Rosenberg is the program director for the first and only existing integrative cancer fellowship in the U.S. He is now collaborating with doctors from Yale and Harvard, as well as researchers from Cancer Treatment Centers of America. He will soon be initiating the first human clinical trial on advanced stage cancer patients using this novel technique. Dr. Rosenberg is also the scientific advisor for Life Length. Please welcome Dr. Mark Rosenberg.
Thanks, Michael. Good morning. I noticed everybody getting up and leaving just before I speak. I hope it's not personal. I'm going to talk, I think every good lecture should tell a story, and I think this will tell an exciting story and may even change what many of you do in your practice as well as personally. And it certainly has changed. Putting together this lecture has changed what I do. We're going to quickly go through some of the basics of telomeres. I know there was another lecture talking about telomeres, and then we'll get into the nitty-gritty. So in 1961, Leonard Hayflick and his colleague Paul Moorhead discovered that cultured normal human cells can only divide a certain number of times, after which they stop, they become enlarged, and they enter a new pathway called cellular replicative senescence. And they discovered that there's a molecular clock, and once this clock expired, there's no more cell division. The withdrawal from this cell cycle is called entering into cellular replicative senescence, and the trigger for that is shortened telomeres. So telomeres, as I know you've heard, consist of repeat bases TTA, GGG, and it's got an associated protein called shelterin. And this whole complex protects the end of the chromosomes from making mistakes like end-to-end fusions and certainly other end processing mistakes. The telomeric TTA-GGG repeats shortens with each cell division as well as from oxidative damage. So the primary factor that accelerates the shortening of the telomere, in addition, of course, to cell division, is oxidative stress. And that's what this talk's going to be about. Now, when a few telomeres become critically shortened, there's a growth arrest state, at which time DNA damage signaling and cellular senescence is triggered. In the absence of other changes, cells can remain in this quiescent or senescent state for years. And this can be thought of as a potent anti-cancer protection mechanism for species that live a long time. Human tumor cells derived from carcinomas almost universally bypass cellular senescence and this DNA damage signaling pathway. And how do they do that? Well, they overexpress and oversecrete telomerase. Telomerase is an enzyme that puts the telomere back. And telomerase is detected in approximately 90% of all malignant tumors. And it may predict a poor favorable outcome. So we can actually look at telomerase as a tumor marker and certainly also target it in cancer therapeutics. And so this is a graph just showing that the embryonic stem cells or the germ cells, you can see their telomere length is staying the same throughout time because they are significantly expressing telomerase. The pluripotent stem cells are also significantly expressing telomerase, but not to the extent of the germ cells or the embryonic stem cells. And then normal cells in red, you can see they're not expressing telomerase. And so with time, their telomere length will decrease until they reach a critically short stage at which they enter cellular replicative senescence. Now, cells that bypass that, even though they should have check pathways, well, then they can enter crisis stage, where they become very, very unstable genomically, And at this point, if the cells don't die, most often what they do is they overexpress telomerase, and then they have a great chance of becoming a malignant cell or a cancer stem cell. Okay? And that's exactly what this shows. Now, the cancer stem cell was likely to have very short telomeres when telomerase was reactivated. So, obviously, what we're getting at is having a high percentage of critically short telomeres may predispose to cancer, and we'll get into this now. So studies have shown that cancer cells with stem-like markers have similar or shorter telomeres compared to the bulk of the tumor. So there may be either an advantage and mechanism to maintain subsets of cancer cells at very short telomere lengths, or the length varies with differentiation state of tumor cells. The vast majority of human cancer cells have telomeres that are generally the same or shorter than adjacent normal tissues, providing evidence that the cancer cell only expresses enough telomerase to protect itself from DNA damage. In other words, there's no advantage for the cancer cells to have long telomeres. It's only going to produce enough telomerase to just maintain cell and genomic viability. In the absence of intact critical checkpoints, as we talked about, the genomic instability occurs when the telomeres are too short, and then the end-to-end fusions and anaphase bridges eventually lead to telomerase reactivation. Re-expression or upregulation of telomerase in cancer may reduce the ongoing chromosomal instability that occurs in cells in crisis to a level compatible with viability. Bottom line, telomere shortening may be a common underlying cause of chromosomal rearrangements in cancer. The function of normal tissue stem cells appear to change with increased age, and this may due in part to progressive telomere shortening. Tissue stem cells also show progressive shortening of telomeres with increased age, whereas, of course, the embryonic stem cells fully maintain their telomeres. And that's, of course, due to the significant expression of telomerase. Now, similar to the embryonic stem cells, the cancer cells maintain stable telomere lengths, whereas normal tissue stem cells are telomerase competent, but mostly silent. It's now widely accepted that replicative aging serves as a brake against malignancy. Cancer cells require multiple mutations to become malignant. Each mutation probably uses 20 to 40 divisions before achieving a population size sufficient for another spontaneous mutation to occur. So pre-malignant cells usually face the barrier of replicative senescence before accumulating enough mutated pathways to become frank malignancies. One critical step in oncogenesis involves the upregulation or reactivation of telomerase, and approximately 85 to 90% of all tumor biopsies are telomerase positive. So some of you out there who are familiar with telomerase activators, you see there's a double-edged sword. Telomerase overexpression we worry about with cancer. On the other hand, telomerase, putting back critically short telomeres, may make you live longer. And we'll go into this in the future slides. So now we're looking at a study, telomere length and risk of incident cancer and cancer mortality. The aim of this study was to assess the association between leukocyte telomere length and the risk of both cancer manifestation and cancer mortality in the prospective population Bruneck study, with near complete participation and follow-up and detailed information on all types of new onset cancer. This was a very interesting study. They looked at 1,000 individuals aged 40 to 79 years, and this took place in Italy, and they examined the individuals every 5 years starting from 1990. New onset cancers were identified by patient self-report and screening of information provided by general practitioners, death certificates, and the Bruneck hospital files. Participation rates in the evaluation from 2000 to 2005 exceeded 90%. So this was a very unusual study. It was a very well done study. During the 10-year follow-up, 92 of 787 participants, or almost 12%, developed cancer with an incident rate of 13.3 per thousand, in 44 of whom it was fatal. Compared with participants who remained free of cancer, the cancer cases were older, physically less active, and more likely to be current or ex-smokers. Moreover, they consumed more alcohol and had lower levels of LDL cholesterol and higher levels of C-reactive protein. Many of you may be familiar with the early Framingham data and now recent data, once again, showing that LDL correlates with an increased incidence of cancer. Once again, we have not proven causality, but there is a correlation. Baseline telomere length was substantially shorter in participants with incident cancer than in those who remained free of cancer. A significant decrease in telomere length was seen with age. Men had shorter telomeres than women, which is usually the case, and further associations were observed for the variables of diabetes, physical activity, which we'll get into in later slides, vitamin D, presence of chronic infection, the inflammatory cytokine interleukin-6, and high levels of C-reactive protein. Telomere attrition was most pronounced in participants with the longest telomere length, whereas interestingly, and we'll show a slide, the individuals with very short telomeres actually had a paradoxical increase in telomere length. Short telomere length at baseline emerged as a significant and independent predictor of new onset cancer. I want to say that again. So short telomere length at baseline emerged as a significant and independent predictor of new onset cancer. And this raises an interesting point. Should we start testing on everybody the percentage of critically short telomeres to get new information on risk? Compared with participants in the longest telomere length group, the multivariable hazard ratio for incident cancer was 2.15 in the middle length group and 3.11 in the shortest length group. So incidence rates were 5.1 per 1,000 person years in the longest telomere length group. It was 14.2 in the middle length group and 22.5 per 1,000 person years in the shortest length group. Very significant finding. Of note, telomere length was preferentially associated with individual cancers characterized by a high fatality rate, such as gastric, lung, and ovarian cancer, but less so with tumors that had a better prognosis. A total of 44 participants died of cancer. An association was seen between baseline telomere length and cancer mortality that surpassed the associations obtained for cardiovascular mortality and mortality from other causes. Compared with participants with the longest telomere length, the multivariable hazard ratio for cancer mortality was 5.63 in the middle length group and 11.1 in the shortest length group. In absolute terms, we're talking 2, 14, and 28 of individuals in the longest, middle, and shortest telomere length groups, respectively, died of cancer. Furthermore, an analysis revealed telomere length to have a similar predictive value for cancer in both men and women and in various age groups. So the author's comments, to their knowledge, this was the first prospective population-based study to estimate the impact of telomere length on overall cancer manifestation and mortality. They demonstrated significant inverse correlations between the baseline telomere length, or leukocyte telomere length, and both cancer incidence and mortality, which emerged as independent of the standard cancer risk factors. There was evidence of heterogeneous effects according to cancer type, once again, whereas the tumors with a high fatality rate tended to exhibit more prominent relationships with telomere length as opposed to the more benign or less aggressive tumors. A variety of experimental and genetic studies support the hypothesis that telomere attrition contributes to the manifestation and dissemination of malignancies, while fully functional telomeres confer protection of the genome. Shortened telomeres facilitate chromosomal instability. Moreover, a significantly higher production of VEGF, vascular endothelial growth factor, in the senescent cells may actually stimulate tumor growth and dissemination by promoting neovascularization. So here's another way that we can see that degrading telomeres and unstable cells will actually release more vascular endothelial growth factor, which is the major growth factor for neoangiogenesis for cancer cells. It's appealing to assume that the association between short leukocyte telomere length and cancer formation is partially mediated by the aging of the immune system itself. Aging of leukocytes, reflected by short telomere length, may impair immune surveillance and actually reduce the clearance of tumor cells. The importance of an efficient immune system in tumor defense is substantiated by the excess tumor incidence among patients with AIDS or patients who are immunosuppressed. And here was that Bruneck study where you see the individuals with the longest telomere lengths, they had a very rapid degradation. But interestingly, when you go to the very low, short telomere lengths at the bottom of the screen, they actually had a paradoxical increase in telomere length, suggesting that at short telomere lengths, you may actually start secreting a little bit of telomerase, even before you hit critically short. And one of the things we know is that inflammation and chronic inflammation can actually stimulate the release of telomerase reverse transcriptase. It is tempting to speculate that cells with a critically short telomere length may, under certain circumstances, reactivate the enzyme telomerase to escape from cell senescence and thereby facilitate malignant transformation. Telomerase expression has been documented in normal peripheral blood. Leukocytes, T lymphocytes, as we talked about, upregulate the reverse transcriptase telomerase in response to inflammation. Okay, so circulating leukocyte telomere length and oxidative stress. So what I'm going to demonstrate now is a link between leukocyte telomere length, not only cardiovascular disease, but oxidative stress. Individuals with shorter leukocyte telomere length present a higher prevalence of cardiovascular risk factors, coronary artery lesions, and cardiovascular mortality, especially acute MIs. This increased risk seems independent of the classical risk factors like high sensitivity C-reactive protein, and strongly suggests a link between leukocyte telomere length shortening and coronary artery disease. Now, oxidative stress and inflammation are major factors that accelerate age-related telomere shortening, leading to the hypothesis that telomere attrition could serve as a biomarker of the cumulative burden of oxidative stress and inflammation. Now, because of the high guanine content in the telomeres, telomeres are highly sensitive to reactive oxidative species. Emerging data, interestingly, suggests the HMG-CoA reductase inhibitors, the statins, have a beneficial effect on telomere biology, possibly contributing to the beneficial effects of statin therapy. Moreover, statin therapy has been shown to prevent telomere leukocyte erosion of the endothelial progenitor cells of healthy subjects or after 12 months of intensive statin therapy in coronary artery disease patients. Now, I know a lot of us don't like to use the statins for multiple reasons, but the statins may do some very interesting things with regards to preventing inflammation, which may be the primary way that it works, but also reducing oxidative stress and thereby reducing telomere attrition. Okay, so here's a study where they looked at circulating leukocyte telomere length and oxidative stress, a new target for statin therapy. Because of time constraints, I'm going to bypass these slides, just telling you that we are seeing an effect with statins and a positive telomere effect. Okay, leukocyte telomere length and major depression, correlations with chronicity, inflammation, and oxidative stress, preliminary findings. Many of my patients ask me, what is oxidative stress? And I tell them that anything you perceive as stress is oxidative stress. And you'll see here that psychological stress is oxidative stress. Leukocyte telomere length was compared between 18 unmedicated major depressive disorder subjects and 17 controls, and was correlated with lifetime depression chronicity, but also they looked at the peripheral markers of oxidation. Specifically, they looked at F2 isoprostane over vitamin C ratio, as well as the inflammatory marker interleukin-6. Overall leukocyte telomere length in base pairs was not significantly different in the depressed group versus the controls. The authors had predicted that not all depressed subjects would be equally likely to show shortened telomeres, since the lifetime of exposure to depression varied greatly in the subjects, and since telomere length is believed to reflect cumulative history of cellular reproduction and of exposure to cytotoxic stimuli such as oxidation and inflammation and to stress. So what the authors did is they examined telomere length within the depressed group as a function of cumulative lifetime duration of depression. And next, as a secondary test of their hypothesis, they dichotomized the lifetime exposure to depression into a categorical independent variable, comparing the control subjects to the depressed subjects in the highest half of lifetime depression. Telomere length within the entire depressed group was significantly inversely correlated with lifetime depression duration. Individuals with greater lifetime duration of major depression had significantly shorter telomeres. Don't be depressed. When depressed individuals in the upper half of lifetime exposure to depression were compared to control, significant differences in telomere length were observed. In the combined sample, the depressed plus the control group, the oxidative stress ratio, as measured by F2-isoprostane over vitamin C, was significantly inversely correlated with telomere length. And this relationship remained significant in the separate depressed and control groups. Considering the components of this ratio separately, vitamin C concentrations were significantly positively correlated with telomere length in the combined sample, as well as the individual depressed and control samples. F2-isoprostane concentrations also were significantly negatively correlated with telomere length. Interleukin-6 concentrations significantly inversely correlated with telomere length in the depressed group. After controlling for lifetime duration of depression, the relationship between the oxidative stress ratio and interleukin-6 concentrations and telomere length remained significant. So the bottom line here, what I'm saying is, aging promotes aging. Leukocyte telomere shortening results in immunosenescence and impaired leukocyte function, which leads to increased inflammatory cytokine output and increased oxidative stress, thereby promoting further leukocyte telomere length shortening, thus forming a vicious cycle. Okay, well, what ways are there to mitigate telomere attrition? Exercise is amazing. And here's a study where they looked at buffering the effect of chronic stress on telomere length. Accumulating evidence suggests that one of the pathways through which chronic stress impacts health is through accelerated cell aging, as indicated by the length of the telomeric DNA. In the first study to link psychological stress with short telomere length, it was demonstrated that among premenopausal women caregiving for a chronically ill child, duration of caregiving was associated with short telomere length. But not all people who have chronic stress have these problems and have shortened telomeres. So the authors proposed that physical activity can moderate the impact of stress on cell aging. Physical activity is related to longer telomeres, both in a national sample of twins and in endurance-trained athletes compared to sedentary controls. So the authors hypothesized that chronic stress will be related to short telomeres only in those who are inactive, defined as not engaging in recommended amounts of physical activity across a 3-day period, while physically active adults will show no association between stress and telomere length. The authors examined these associations and the protective capacity of exercise in 63 postmenopausal, healthy, non-smoking women. Consistent with previous studies, the data in this study indicated that higher perceived psychological stress is, in fact, associated with shorter telomere length. Importantly, physical activity was able to protect those experiencing stress by buffering its relationship with telomere length, as hypothesized. These findings support the physical benefits of activity and, interestingly, map well into Centers for Disease Control recommendations, which recommend 75 minutes of vigorous activity per week. The mechanisms by which stress impacts the body at the cellular level are unknown, but one likely pathway, of course, is telomerase activity. Chronically stressed individuals have lower telomerase activity and often demonstrate altered glucocorticoid profiles. Higher excretion of urinary stress hormones is related to lower telomerase and shorter telomeres. Further, a recent experimental study demonstrated that exposing human lymphocytes in vitro to high levels of cortisol during primary stimulation and upon subsequent restimulation can dampen telomerase activity. Autonomic nervous system profiles associated with chronic stress are also associated with lower telomerase activity. So I know we talk about adrenal stress very often, but I think most of us don't consider the adrenal stress effect on telomere length. Well, now we have data that really shows it does decrease telomerase expression. Physical activity training augments telomerase activity in the myocytes and circulating mononuclear cells in rats and in human leukocytes, providing a plausible and potentially testable pathway to explain the author's findings. Exercise might also buffer telomere shortening through affecting the balance between oxidative stress and antioxidants. And certainly we know that aerobic training can enhance your endogenous production of antioxidants, but there's a limit, because then when you get into the serious endurance athletes, the athletes doing long distance and marathons, then we see increased oxidative stress. The authors also examined the interval of physical activity above which stress no longer significantly predicted telomere length. The data indicated that above around 40 minutes of vigorous activity over 3 days, stress was no longer associated with short telomeres. Once again, this is very compliant with the CDC's recommendations. Recent longitudinal studies further underscore the notion that telomere shortening may constitute a biomarker for deleterious health status. This is very interesting. In one study, lymphocyte telomere length at age 60 was shown to be predictive of subsequent lifespan. The T-cell involvement in these associations is underscored by the fact that the individuals with telomere lengths in the shortest quartile at age 60 had a 7 to 8-fold greater risk of dying of infection as compared with those in the longest telomere quartile group. The Swedish so-called Octo and Nona longitudinal studies actually looked at a variety of physiological parameters associated with lifespan, and they identified a cluster of immune parameters that strongly was predictive of early mortality, independent of the cause of death. And specifically, they found that reversal of the normal CD4 to CD8 ratio, reduced T-cell proliferative potential, an increased proportion of senescent T-cells manifested by cells not expressing CD28, and evidence of CMV infection. I am routinely in my practice doing a lymphocyte subset panel. Now, where I'm looking at CD4 to CD8 ratios, I'm looking at mature T cells or CD3. I'm looking at natural killer cells. So I want to summarize the conclusion so far, and then in the next 12 minutes, we're going to speed this up, and you're going to see that there are things we can do about this. Critically short telomeres increase the risk of cells becoming malignant. We covered that. Baseline leukocyte telomere length, independent risk factor for cancer incidence and mortality. Shorter leukocyte telomere length was associated with an increased prevalence of coronary artery lesions and an increased risk of cardiovascular mortality. Lymphocyte telomere length at age 60 was shown to be predictive of subsequent lifespan. Oxidative stress and inflammation are major factors that accelerate age-related telomere shortening. Elevated oxidative stress markers, and specifically the ones mentioned, F2-isoprostane, interleukin-6, we didn't get time to cover OGG1 and FOS, they are associated with shorter leukocyte telomere length. So, by the transitive property, if oxidative stress correlates with leukocyte telomere shortening, and leukocyte telomere shortening correlates with age-related disease and mortality, then oxidative stress correlates with age-related disease and mortality. And if increased oxidative stress correlates with age-related disease and mortality, can nullifying or mitigating oxidative stress affect the aging process as well as mortality? So if we change our lifestyle through calorie restriction, eliminating other habits that increase oxidative stress, participate in moderate exercise on a regular basis, and increase our intake of antioxidants, can we slow the degradation of our telomeres and improve the quality of our life while extending lifespan? Well, yes. Now we're going to actually get into some slides actually looking at antioxidants and how they affect telomere length. Magnesium. Everybody knows how wonderful magnesium is. It's required for catalytic activity of so many enzymes, including those involved in DNA replication, DNA repair, and RNA synthesis. Dietary magnesium intake has been shown to be positively related to telomere length in women. Long-term magnesium deficiency leads to shorter telomeres in rats and cells grown in culture. This decrease in telomere length during magnesium deficiency is also accompanied by an increase in oxidative stress. Reduced availability of magnesium ions negatively influences genome integrity. Magnesium is necessary for the functioning of endonucleases involved in base excision repair of DNA. Insufficiency of magnesium reduces DNA repair capacity and induces chromosomal abnormalities. Hence, it is reasonable to hypothesize that magnesium influences telomere length by affecting DNA integrity and repair in addition to its potential role in oxidative stress and inflammation. Without question, you should be measuring red blood cell magnesium. I'm basically having, if a patient's not in renal failure, I have everybody taking magnesium, including me. There's also a relationship seen between folate, a direct correlation between folate and telomere length. Folate's involved in methylation, very important for DNA and for DNA integrity. Vitamin B12, the same thing. Vitamin B12 has strong antioxidant properties and has the effect of sparing the reactive oxidative species scavenger glutathione, thus reducing oxidative stress. In addition, supraphysiologic doses of vitamin B12 derived from supplements can inhibit nitric oxide synthase and potentially reduce inflammation. The reduced oxidative stress and inflammation due to the high dose of B12 may explain the longer telomeres in individuals who use B12 supplements. Now, I do want to differentiate. Once an individual has advanced stage cancer, their cancer cells are greatly overexpressing B12 as well because they need it for cell division. Those individuals, I do not supplement B12. Vitamin D. We all know how important vitamin D is. Richards et al. Reported a positive association between the concentrations of vitamin D in serum and telomere length in peripheral leukocytes in women. The biologically active form of vitamin D, 1,25-dihydroxy, possesses immunosuppressive properties, but appropriate immunosuppressive properties. And this is reflected in the inverse relationship between plasma concentration of vitamin D and the inflammatory marker CRP. Telomere length has been negatively correlated to plasma concentration of CRP in several studies. Vitamin D also reduces expression of inflammatory mediators, interleukin-2 and interferon gamma. Vitamin C and E, despite these historical retrospective studies that we read online, vitamin C and E, either from diet or multivitamins, is positively associated with longer telomeres in a dose-dependent manner in women. Age-dependent shortening of telomeres as well as decrease in telomerase activity in cell cultures can be slowed down, and lifespan can be increased by addition of physiologic concentration of vitamin C or E to the culture medium. Vitamin C and E may limit, of course, oxidative damage to the telomeric DNA. Zinc. Zinc-dependent enzymes in the cell include DNA polymerases, RNA polymerases, and reverse transcriptase. Providing additional zinc in the cell culture medium increases activity of telomerase, which is a reverse transcriptase. I take 25 milligrams of zinc every day. Zinc is necessary for activation of the poly-ADP ribose polymerase involved in DNA repair at DNA damaged sites. In humans, deficiency of dietary zinc has been shown to cause DNA damage. In older subjects, percentage of cells with critically short telomeres and decrease in telomere length are associated with decrease in concentration of intracellular labile zinc and the zinc-binding protein metallothionein in peripheral blood mononuclear cells. Zinc also has a protective role in oxidative stress. A direct role for zinc in removing free radicals has not been proven, but it has shown that dietary zinc deficiency is associated with oxidative damage. Supplementing with zinc has shown to reduce oxidative stress and inflammation. Omega-3 fatty acids. You're all very familiar with EPA and DHA. Well, the concentrations in the blood of DHA and EPA have directly correlated with telomere length as well. Curcumin. Curcumin is wonderful. Most of the studies on cancer have been done at MD Anderson Cancer Center with curcumin. Incredible substance. And of course, I take curcumin. It induces synthesis of the antioxidant glutathione, and it inhibits the release of the chemokine interleukin 8 and activation of the nuclear transcription factor NF-kappa beta that mediates inflammatory response. Mice-fed diets containing curcumin show decreased DNA damage and a trend for longer telomeres. So there's a new paradigm for life extension. And literally putting together this lecture has changed my life and what I do, because it's amazing when you can actually see that the supplementation, changing in lifestyle, can truly affect telomere attrition. And telomere attrition, as you will see, can affect lifespan. So the new paradigm is measure baseline telomere status. And what's so critical is to measure the percentage of critically short telomeres, because remember, the critically short telomeres are the ones that could have a great chance of bypassing crisis and actually causing malignant cells, as well as measuring the median telomere length. So I'm doing that on my patients for starters. Now, simultaneously, I want to see what their indicators of oxidative stress are. So I'm measuring interleukin 6, 8, F2 isoprostane, 2 necrosis factor alpha. You can throw in other markers as well, like C-reactive protein. I'm measuring your immune status, as we talked about. Measure the antioxidant status and their vitamins and minerals. And then make lifestyle changes as indicated. Begin them on an antioxidant regimen. You can consider other natural telomerase activators. Some of you may have heard of TA65 and astragalus. I am taking the raw herb astragalus. There is a plethora of literature on PubMed with regards to astragalus inhibiting cancer, but also stabilizing telomeres and even inducing telomerase activation in normal cells. After 3 months of having this patient on the new regimen, remeasure their oxidative stress indicators. When you have their oxidative stress indicators down to an acceptable or a better level, then in another 6 to 12 months, repeat the telomere measurements and see if they have a lower percentage of critically short telomeres. Well, is this all just conjecture? This, in my last 2 minutes, was extremely exciting. This is hot off the presses. Telomerase gene therapy in adult and old mice delays aging and increases longevity without increasing cancer. Treatment of 1- and 2-year-old mice with an adeno-associated virus of wide tropism expressing mouse telomerase reverse transcriptase had remarkable beneficial effects on health and fitness, including insulin sensitivity, osteoporosis, neuromuscular coordination, and several molecular biomarkers of aging. Telomerase-treated mice did not develop more cancer than their control litter mates, suggesting that the known tumorigenic activity of telomerase is severely decreased when expressed in adult or old organisms using this adenovirus. Finally, telomerase-treated mice, both at 1 year and at 2 years of age, had an increased median lifespan of 24% and 13% respectively. We're talking about, think about this, we're talking about, if we extrapolate this to humans, increasing the median lifespan to about 100 years of age, median lifespan to about 100 years of age, not even talking about maximum lifespan. These results constitute a proof of principle of a role of TERT, telomerase reverse transcriptase, in actually delaying physiologic aging and extending longevity in normal mice through a telomerase-based treatment, and demonstrates the feasibility of anti-aging gene therapy. Well, this is not ready for prime time yet in humans, but what is ready for prime time is that paradigm that I previously mentioned to decrease oxidative stress, verify that you have decreased oxidative stress, measure the percentage of critically short telomeres, and it is possible, and the data is coming in, that we can significantly not only extend lifespan, but of course improve quality of life. Thank you.